Hello, my name is Dr. Matt Ahern. I am a consultant haematologist at Leicester Hospitals and also an honorary senior lecturer at the university. I look after patients in the hospital with a type of blood cancer called aggressive T-cell lymphoma. Unfortunately, many people with this type of lymphoma do not respond to the chemotherapy drugs that we use and often only survive for 1 or 2 years after diagnosis. So we urgently need new treatments, new drugs that we can improve clinical outcomes for these people. What we need to be able to do in the clinic is to identify which patients are unlikely to benefit from chemotherapy so that we are avoiding ineffective and toxic treatment, but able to consider alternative approaches. At the moment, what we do is take a tissue biopsy, often from an enlarged lymph gland, to gather information about that person's lymphoma. But we know that this approach is limited. It doesn't capture all the information that doctors need. And we know that the lymphoma can change during treatment, but tissue biopsies are invasive. They're not pleasant for patients, and they can't easily be repeated. A solution to this is using our understanding that cancer cells release and shed important information directly into the bloodstream. And so we can take a blood sample to capture this information, and that has several advantages, not least that it can be easily repeated at multiple time points. And so what liquid biopsies, which is the term that we now call these blood samples, can offer doctors is an ability to track how a cancer is responding to chemotherapy in real time. So our research will look to develop liquid biopsies as a tool that we can use in the clinic to help patients with T-cell lymphoma. Our initial work, which was funded by Hope Against Cancer, looked at local patient samples and demonstrated that this is a feasible approach. We now need to expand that on a larger cohort of patients, which we plan to do over the next few years. Ultimately, however, we hope that liquid biopsies will help doctors make clinical decisions for patients with T-cell lymphoma. Of course, none of this work would be possible without the patients that donate samples, but also the funding bodies that support this work. I'd like to take the opportunity to thank Hope Against Cancer, who really kick-started this project with support. Thank you very much.